Hi everybody, Dr. Kaylee here. I'm the owner and founder of the Hope Doctors Pelvic Floor Physical Therapy, and super excited to be here to talk a little bit more about the importance of looking at the full body when you do see a pelvic floor physical therapist, and also kind of why we do it and what may set us a little bit apart at the Hope Doctors and why I've kind of created our method that way. So first and foremost, typical general pelvic therapy is you go in, you take your pants off, they do an internal exam, they usually hook you up to something like biofeedback, or they teach you how to do a Kegel, and then they send you on your merry way. That's unfortunately kind of like the general way of doing pelvic therapy. And that has kind of been discounted in multiple different ways over the past probably 10 years or so. We're starting to see a lot more research and evidence on how other parts of our body are connected to the pelvic floor, how certain types of things can impact your pelvic floor, like your feet, like your hips, like your rib cage, like your jaw, like all of that is starting to kind of circulate and come out. And so we can't only focus on the pelvic floor. And I always tell people too, like the pelvic floor, the vaginal muscles, the muscles underneath, like the genitalia, all of that, it's only one piece of the puzzle. As a physical therapist, we go to school to learn the whole body, and we learn how to kind of connect head to toe. What do the muscles do? What do the nerves do? What are all the connections points, like the connective tissue, the fascia, like how does one thing impact the other? And so our literal job as pelvic floor physical therapists is to connect the dots. And so it's always kind of baffled me when people just treat the pelvic floor or when they only do internal work. Because while yes, it's important in my opinion to do the assessment, to know what the muscles do, because that's partly what sets us apart versus a general physical therapist, we don't need to spend all of our time there. Because, for example, if someone comes in and they're doing, if you don't follow us on Instagram at the.hopedoctors, you should, because we share client stories, testimonials, and we have kind of a theme every week that we're going off of, and it's been really helpful. I shared recently a story about, or I'm sharing this week, a story about a client who came in and she was experiencing a lot of urinary leakage, and leakage with jumping, running. So many of us can relate to that. Lifting her kids, hiking, getting to certain mileage on certain things, and having a lot of difficulty just holding her bladder. And she went to 3 other pelvic floor therapists in the area, and they all 3 did similar things. They gave her some glute bridges, some clamshells, they gave her some Kegels, and then they were pretty much like, we're gonna do muscle work, but we don't know why. And so when she came in to see us, we did a head to toe exam, because the way that your jaw sits, if you have tension in your jaw, the fascia and the muscle connections do connect to the pelvic floor that can cause tension and fascial connections. If you do not have good foot mobility and you land on a stiff foot and the middle of the foot or the arch does not have function, you're going to have more force going up the kinetic chain, and oftentimes the pelvic floor has to take that force because there's nowhere else for it to go. If you don't have rib cage movement and there's restrictions in the mid-back and the rib cage, the diaphragm, the pressure again is gonna have to go somewhere, so it's gonna go down into the pelvic floor. If you're female and you have like a vulva, right, you don't have anything else externally to block the pressure or anything from happening. So you have to be able to use all the rest of the system to absorb the pressure, to send it to the right places, to move it, to change it. Like there's just so many different things that we have to consider versus like just the pelvic floor. So for example, when she came in, we did all of our functional movements. So we're looking from head to toe. I'm having her do some spine movement, squats, we're jumping in clinic, we're running. Another thing, if you're searching for a pelvic therapist and they do not get you in the position or do not have you do the thing that causes the issue, you're missing out, because it's key for us to watch it. So I watched her do all of these things, and I realized there was no rotation in her thoracic spine, and her midfoot, her foot was very stiff when she was jumping. There was no absorption happening. So of course it's gonna go to the pelvic floor and cause leakage. Your bladder holds on to the urine on the inside, and on the outside there's more pressure. The bladder pressure needs to be higher than the pressure on the outside. Otherwise, it's just gonna leak. There's gonna be no control or ability. If the system is not functioning or working appropriately to make that happen, to keep the bladder pressure higher, then of course we're gonna leak. But we have to figure out like the root cause for it. Leaking is not just a weak pelvic floor. We're past that. It's also not just a too strong or hypertonic pelvic floor. We're past that. It's a lot of other factors. There's a lot of other things that we have to consider. the landing mechanics, the running mechanics, the lifting, the muscle activation. Do you have good glute control? Can you activate your obliques? Can you release tension around the diaphragm and still breathe appropriately? Do you have rotation in the spine? Is your foot mobility improving? Is it worsening? There's so many different things that we have to look at, and it's important because one thing can contribute to another. So this gets a lot of people, because if you come to pelvic floor therapy and you're like, hey, I've seen a lot of other pelvic therapists, I already know that they didn't take that full body approach, because if they did, we don't chase the symptom, we chase the root cause. And so when we find the root cause, we can treat the root cause, and the root cause trickles down to have good function, doesn't cause issue. And so it's really important that you find a provider that can do that. And I always encourage clients, if you don't live here, if you can't see us for whatever reason, at least call the providers around and ask them, do you do a full body approach? Do you look from head to toe? Walk me through your process, because you need to know that you're getting that whole thing. So hopefully that helps to kind of clarify the whole body approach. It's all connected, our whole body's connected. So it's really important that you get that type of an evaluation to determine what exactly is causing your pressure, your heaviness, your leakage. Pain with intimacy is another one that often is thought we only need internal work and stretching. Way past that, there's a lot of mobility issues up the spine, a lot of jaw tension that we see, foot lack of mobility, impaired ability to activate certain muscles. We've got to be looking for those and combining them into a treatment approach that works for you. So I hope that clarifies some questions. Drop any questions that you have down in the comments. Don't forget to subscribe, and I will see you next week.